Hey everyone, my name is Jacob DeCamp. I am a fourth year pharmacy student at the UGA College of Pharmacy. I am meeting with you today to go over COVID vaccines, truths, myths, and why you should get one. This is an educational PowerPoint that we're going to hope to answer any questions you may have about the COVID vaccines that have recently been released and approved, and we definitely just want to give you a pretty basic knowledge and dive in a little deeper to alleviate any of your concerns about getting the vaccine and discuss why we think you should get one. So while we're here, vaccines are our most effective way to combat COVID-19 and restore society to a sense of normalcy. This is a completely educational presentation designed with the hope to inform you on available vaccines, explain why they're important during this pandemic, address any myths that you may have heard about, and answer any questions you may have as well. So how bad is COVID-19 right now? So as I'm sure you guys are all aware, we've been in more than a year of this battle against COVID-19 and the virus that causes it, to the point where we've shut down our normal way of life. And it's been a pretty difficult and trying time for a lot of individuals. And I'm sure that it's affected each and every one of you in a very specific way. But just want to give you a little bit of statistics on how bad COVID-19 is. So currently in the US, there are more than 25 million known cases in the country. That's confirmed cases by using tests. We can test in different ways, but there's been at least 25 million known cases in the US, and there's been far more unconfirmed, where people have probably had the virus and not known, or they went untested and it was not confirmed and documented. So along with those 25 million known cases in the US, there's been more than 440,000 deaths, and it continues to rise. So adults of any age with certain underlying medical conditions are at increased risk for severe illness from COVID-19. Severe illness would be defined as hospitalization, being admitted to an ICU, and then into worse situations where patients could be intubated or put on a mechanical ventilator and then subsequently die. So some of those conditions that I just spoke about are listed here. They can include, but are not limited to, these. I just picked a few examples. So as you can see, obesity, smoking, heart conditions, COPD, cancer, immunocompromised state, and of course diabetes. And that's why we wanted to have this talk with you, because most of you are diabetics yourself, and we want to walk you through why it's important for you to be educated on COVID-19 as a virus and the treatment options, specifically the vaccines that are rolling out, and why they're so important for someone with your condition. So why are you at higher risk of a diabetic? So this graphic here is a graphic from the CDC, the Centers for Disease Control and Prevention, and it states that hospitalizations were 6 times higher and deaths 12 times higher for COVID-19 patients with reported underlying conditions. Again, these three right here: cardiovascular disease, diabetes, chronic lung disease. These are not all of the underlying medical conditions that have been shown to lead to poorer outcomes if you do get infected with COVID-19. But essentially, why that is, why are you at a higher risk as a diabetic? Well, if you become infected with COVID-19, it triggers an immune response in your body. So where your body starts to fight it off, just like any other sickness, whether it's a cold, whether it's a flu, any type of infection, things like that. So the stress that is placed on your body from fighting COVID-19 can lead to poor blood sugar control, because your body will prioritize fighting off that infection and the symptoms that you're having of that, in lieu of, or instead of, making sure that it's regulating your blood sugars like it's supposed to. And as a diabetic, obviously you already know that your body doesn't control its blood sugar like it's supposed to. So as a consequence of that, this can lead you to have a higher risk of diabetic ketoacidosis, which is a very acute thing that some of you may be aware of or have experienced in the past. But that is something that is a serious acute health issue that could lead to hospitalization. Poor blood sugar control can also lead to kidney and heart complications. So COVID vaccines. So the goal of any vaccine, but specifically COVID vaccines, are to teach your immune system how to recognize and fight the virus that causes COVID-19, which hopefully will lead to a higher chance of immunity to the disease. So in the US, there are currently 2 approved in the US for emergency use. There's a Moderna vaccine and a Pfizer vaccine. We'll get into the details of each specific vaccines in a minute, but I just want to let you know that those are the ones that we currently have approved. There are more coming through the pipeline that we hoped that are expected to be approved relatively soon. So hopefully we can have a larger supply so we can get more people vaccinated as soon as possible. And I just want to throw in this caveat here: the technology being used in these vaccines has been studied for more than 10 years. So we're going to get into the approval process and try to discuss why these vaccines were turned around after being designed or the technology being discovered. I want to discuss what's different about these vaccines, but ensure to you that they are safe and effective so far from what we can tell. So the Moderna vaccine is the first one we'll discuss. Now, this vaccine is a 2-shot series. It's 2-shot series, 28 days apart. So you would get one vaccine, say today, and then 28 days from that first dose, you'll come in to get your second vaccine. The first dose gets you till about 70 to 80% effective, which means that after 14 days for the Moderna vaccine, 70 to 80% of patients who received the first dose did not catch COVID during the trial. I know that's a little confusing, but I'm just laying it out there for you. The first dose gets you to about a little over halfway there to immunity, which is our ultimate goal for any vaccine. The second dose, that dose 28 days later, it's going to get you to that 90 to 95% covered about 14 days after the second dose. So in the meantime, we must continue to wear masks, practice social distancing, wash your hands regularly, practice good hygiene while waiting on the vaccine to take full effect, because we don't want you to do is get the first dose of vaccine and then you catch COVID in between or immediately after either of the doses, and then you're kind of up the mountain on that one. So we want to make sure that you're protecting yourself in between doses. There's no data that exists on how vaccine affects transmission. So we don't know yet whether or not once you've had the vaccine, can you still transmit the vaccine? So that's another reason why we must continue to protect ourselves and others by wearing masks and practice social distancing. I also want to throw in the caveat. Remember that tiered rollout, which we haven't really discussed yet, but there's a tiered rollout going on right now, which means a majority of individuals will not have been vaccinated for several months. So the virus is running crazy right now amongst the population. So just because you get the vaccine doesn't mean you're fully covered. And it's going to be several months before we can return to a sense of normalcy, which is where we're trying to get to. This Moderna vaccine is the one that you're probably going to see in the community setting, as far as if pharmacies like Chancy Drugs or other chain pharmacies are administering the Moderna vaccine because of its storage requirements. Now, the Pfizer vaccine is very similar to the Moderna vaccine. It's a 2-shot series, but it's 21 days apart. So you get the first dose, and then 3 weeks later, you get the second dose. As you can see, comparatively, after the first dose, it's about halfway to immunity where you need it to be. And then after the second dose, we're going to have, that shouldn't say first dose there, but after the second dose, it gets you to about 95% effective, very similar results to the Moderna vaccine. Again, you must continue to wear masks and realize that, because of tiered rollout, it's going to take us several months to get everyone vaccinated. So if you get the Pfizer vaccine, then make sure you're protecting yourself and others. So why 2 doses? Why do we need 2 doses? Well, the easiest answer for that is immunity isn't immediate. I like to use an analogy here, and I have a picture on the right of the slide. Basically, the first dose, imagine getting protection from COVID-19 as pushing a boulder over a hill, right? So the first dose is the initial push of that large boulder that you're trying to push up this mountain and up and over a hill. The first dose gets the ball rolling. That's what we really want. The body starts to produce antibodies against the virus, which is the designed effect that we hope to see. Antibodies basically fight off infection as they detect it. The second shot is what gets you over the hill. The second shot is if you push that ball all the way up the mountain and you get really tired and your legs are weak, the second shot gives you enough energy to just shove that boulder over the top of the mountain. And we'll call over that mountain as immunity. With that said, without the second dose, immunity goes away. So if we don't get the second dose, then the ball is going to roll back over and crush you, and you wouldn't have reached your goal. So I mentioned tiered rollout in an earlier slide, and that's what I want to talk about here. So vaccine eligibility and rollout. So because there is a limited supply currently available of vaccines from Pfizer and Moderna, the federal government is the one managing rollout. The federal government basically purchases doses from the manufacturers and then allocates those doses to states, where they encourage states to organize their own distribution and then implement processes so that the vaccine gets into arms. You might have heard this referred to as Operation Warp Speed under the past administration. Their goal was to get the vaccine produced, get the vaccine distributed, and get vaccine into arms. So most states are using a tiered system in accordance with CDC recommendations on priority populations. We're going to talk about the priority populations in subsequent slides, but I just wanted to put this little infographic here. So basically, this is for the state of Georgia. We'll go into what these phases mean, but this is kind of a visual thing for you to look at if you weren't really sure about what those phases look like. So in phase 1 in Georgia, we have what's called Tier 1A, and it's actually been referred to now as Tier 1A plus because ages 65 and older and their caregivers weren't initially included in the first round of priority populations to receive the vaccine. So under Tier 1A, frontline health workers who have direct patient interaction are the ones recommended to get the vaccine first. Along with first responders, which means police officers, firefighters, 911 operators, people that we really need to help us in times of crucial need. Along with that is long-term care residents, so nursing home residents and staff. We want to get those in there because they are we want to get them vaccinated because they are highly likely to suffer serious complications after catching COVID-19. So we want to make sure that, and with their living situations being in tight quarters and not really getting a whole lot of fresh air, as we can presume, the virus can spread pretty rapidly. And as I mentioned, ages 65 and older and their caregivers is also listed under Tier 1A. So Tier 1B is the next rollout. We don't know when this is going to happen yet. We haven't really been given any guidance from the state on what the timeline looks like for us to receive the approval to start rolling out vaccine to Tier 1B. Tier 1B is basically all your other essential workers. And that means teachers, pharmacy staff, people that work at the grocery store, or people that work in the transportation department, process our food, and then of course, correctional facility staff. Tier 1C is defined as adults aged 18 to 65 with comorbidities. Comorbidities meaning underlying health conditions that could lead to serious complications if infected with COVID. This means patients who have heart disease, diabetes, obesity, things like that. We don't know when this is going to roll out, but we just want to inform you that this is technically your category as of now. It's a very fluid process. The state could come by and say, nope, everybody that has these categories, you're going to be moved up first. We don't know that's going to happen. We haven't been really given any guidance. These are all just recommendations from the state and the CDC, and we're following them as closely as we can to allow. And then once we find out more about when we can roll it out to you guys, we'll let you know. So phase 2 will just be phase 2, 3, and 4 will be age-based, and then phase 4 hopefully will have enough supply of vaccine that we can get it to everyone and systems in place to roll those out. The vaccines are not currently approved for pediatric populations. So once those get approved, we will begin to roll those out to children. So while we're talking about vaccine approval, I know this is a big hot topic when speaking about the vaccine, because a lot of people are unsure about the approval process for the COVID vaccine. So I'm going to start with a fact. So the FDA's vaccine approval process usually takes 10 to 15 years. That is a fact. That is true. The reason it takes so long is because there are many different stages of clinical vaccine development. Clinical development follows a couple other stages that I didn't list on the slide. But basically, first, we have the exploratory and preclinical stages, which basically means that we identify what's our problem. In this case, it's COVID-19 pandemic. We have a virus that is ravaging the planet in the country, and we want to find a way to curb it or eliminate it altogether. Then we get into the preclinical stages where basically we decide, okay, what's the best way to stop COVID-19? In this case, we're talking about vaccines. Vaccines is basically drug manufacturers decide, I think that a vaccine for most viruses has worked in the past. That's the route we're going to go through now. Then we get into clinical development. This is what you may be a little more familiar with, but at the same time, you may have a lot more questions for. So the clinical development is separated into phases. You hear them as phase 1, phase 2, phase 3. Those exist. And basically what those do is they start a clinical trial with a very small population of individuals, volunteers usually, that we start, make sure that we give them a shot. They don't have any serious complications. Is the vaccine safe? And then second, is it effective? That's what we're trying to figure out during these phase 1 through 3 trials. Every drug or vaccine that ever gets any kind of approved goes through these trials. For example, the COVID vaccines that we have currently approved, they had the same amount of patients studied as the Shingrix vaccine. And I'm sure some of you guys are familiar. If you're not familiar with the Shingrix vaccine, it's for shingles, but the same amount, and it's been approved for about 5 years now, 3 to 5 years. So the same amount of people that were studied in those phase trials for shingles is the same amount as the COVID vaccines. And then when, of course, we get into manufacturing and quality control. So I'm just going to kind of lay out the process for you there as far as how does a vaccine get approved. So what's different about this approval process with the COVID vaccines? Well, normally there's a lot of government red tape, which means basically there's a lot of line waiting, paperwork. The FDA balances the potential risk and benefits of products based on the data currently available. So number one, we have to have that data. Number two, they have to be okay to do each and every step of the approval process. They have to identify a mechanism that the vaccine can work in. They can do all these different things, but there is a lot of step-by-step processes which take months to years. And not to mention that normally drugs and vaccines that are going through an approval process, they have to wait in a line, just like if you went to McDonald's and wanted to order a cheeseburger. You have to wait in that line and wait your turn. That's how it works in drug manufacturing and vaccine manufacturing. So in this case, with the COVID-19 vaccines, they streamlined the process. And how did they do that? They used an emergency use authorization. So the emergency use authorization is basically a way for the FDA to grant expedited public access to vaccines that are of crucial necessity to public health, i.e. a global pandemic, COVID-19. So this is a much shorter process due to lack of requirement of waiting for paperwork. Essentially, the FDA says the number one problem that we have right now in the world is the COVID-19 pandemic. Please, anyone and everyone who in the scientific community, please put all of your resources into solving this global problem. And then they basically part the Red Sea and say, COVID vaccines, you move to the front of the line. Whatever you need to do, let's start testing these things. Let's start spitting out vaccines that we can try and see how they work. So we can hopefully curb this before more people get sick, more people die. So the phase trials that are performed for the COVID vaccines are the exact same setup as any other drug or vaccine in the past, whether they were rushed to the front of the line or not. They still go through the process. They still test them on different populations of people, large numbers of people, thousands of people all around the globe participate in these studies so that we have enough people to verify that if we give you a shot, it's not going to harm you. It will also be the most important. The most important thing is that it doesn't hurt you. And second of all, it solves our problem. It makes you immune to the virus. That's our two most important things: safety and effectiveness. So under the emergency use authorization, which the Moderna and Pfizer vaccines are approved, the process is exactly the same, except for the fact that there's not as much red tape. There's not any line waiting. Everyone is pushed to the front of the line with the vaccines. So after saying that, I do want to go into some of the misconceptions and try to answer some questions you may have about the vaccine. So first off, the biggest question is, are the vaccines safe? Yes. Undoubtedly, yes. The side effects are like a flu shot. So most of you should have already gotten a flu shot or other vaccines in the past. And like other vaccines, you may experience some common side effects, like a pain in an injection site whenever they give you the shot. Excuse me. Sore arm for 1 to 3 days. That's completely normal. You might have a little bit of a headache. You might have a little bit of fatigue or tiredness or sleepiness, feel like you're a little down. And then it's also pretty common to run a low-grade fever, less than 100, for a couple days following the injection. But after that, you go back to normal. And it's almost like you didn't get the vaccine. Now, when we talk about anaphylaxis, which is basically life-threatening reactions, that means trouble breathing after it usually happens between the initial shot and 15 minutes after the shot. Anaphylaxis is basically if someone, it's like getting a bee sting and you're allergic to bees, where you have trouble breathing, full body rash. So I pulled some statistics from the CDC, and as you can see, there were 29 confirmed cases of life-threatening reactions out of 1.9 million doses administered. That is an occurrence rate of 0.002%. That is on par with every other vaccine that is on the market today. It's usually because they have an allergy that they don't know about concerning one of the few ingredients that are in the vaccines themselves. It's not that there's anything in there and it's happening to everyone that gets it. It's just some people have allergies that other people don't. So I just wanted to, calm you in regards to, is the vaccine safe? Yes, unequivocally, yes. Out of the now millions of doses that we have administered, there have been very few cases of people having life-threatening reactions. The next question would be, can the vaccine make you sick with COVID-19? No. None of the authorized vaccines or ones in development contain live virus and therefore cannot make you sick with the disease. The vaccine is basically like another analogy. I made the Boulder analogy earlier in the presentation. However, the vaccine is almost like if I was a virus and you wanted to make a vaccine against me, and you took a small hair off my head and put it into a vaccine and then shot that vaccine into your arm, your body, that one little hair of my body is enough information for your body to make antibodies to fight off me if you saw me, if I was the virus. That little bit of non-live, not scary, minuscule part of my hair is enough for your entire body to recognize me if I infected you or came around you. So that's the best analogy I can kind of give as far as that goes. But again, can the vaccine make you sick with COVID? No, it's not giving you live virus. You will not catch COVID by getting the vaccine. Similarly, can the vaccine make you test positive on a COVID-19 test? No, it cannot. So viral tests detect current infection, and since the vaccine doesn't contain live virus, you will not test positive because of a vaccine. Should you get the vaccine if you've already had COVID and recovered? Yes. So it's extremely rare, but reinfection has been shown to be possible. And there is data that shows severe health risks. There are severe health risks associated with a previous infection that could lead to more vulnerability down the line. For example, if you do get reinfected, there is data that shows that you may suffer worse the second time that you catch it. So we want to get you vaccinated so that greatly reduces the chances of you being reinfected with COVID if you've had it in the past. Will a COVID-19 vaccine alter my DNA? That might sound like a crazy question, but it's a completely valid one, and we definitely want to, quell your concerns about this. So the answer is absolutely not. These vaccines, they use something called messenger RNA. These vaccines use messenger RNA to tell your body to make proteins to trigger an immune response to the virus. So the components of the vaccine never interact with your DNA. So my experience, I actually am receiving my second dose of the Moderna vaccine tomorrow. My first vaccine experience was like a typical vaccine experience, other than the appointment process is obviously kind of difficult with scheduling, things like that. But I showed up at the health department for my appointment. They went over a lot of educational material with me and essentially gave me the shot, informed me that I'd be coming back in 28 days to get the second. So the shot felt like a flu shot. It did not hurt at all. I did not have a reaction to it. They did make me stay for 15 minutes. That is the norm across the country as far as being a new vaccine. They want to make sure that make sure that no one is having any serious reactions. Let them sit there so we can, administer help to them if they do require it. In the hundreds of doses that I have administered, I have seen maybe 2 reactions, and of those 2 reactions that I've seen, both patients had previous reactions to a flu vaccine in the past. So it was kind of predictable. They were we asked them to sit there. They did not have we gave them support as we saw fit, and they are doing fine right now. So like I said, I had mild arm soreness lasting 1 to 2 days. I took some Tylenol for a couple days. That completely relieved it. I did have a pinch of fatigue and a slight headache the day after the injection. So that's really all my experience was with getting the Moderna vaccine. It's completely painless process. There are reports that the second dose It's different for everyone. So your symptoms after getting the vaccine may not be the symptoms someone else experiences. Um, there are reports that the second vaccine is a little harsher as far as side effects after. But this is probably because you've already introduced yourself to the virus, to the vaccine. So your body is in hyperdrive in an immune response trying to produce antibodies to COVID. So when you inject that second dose, which is absolutely necessary to get to immunity, your body may have a little bit more of a side effect. But that's great news because you know that the vaccine is working.